In the healthcare field, I think that we need to make some major changes to the system that's been set up by Barack Obama through what we call Obamacare. This is going to take a commitment to transitioning those folks who are basically on Obamacare at this point back to the private health industry and private insurance industry. And I think we can do that over time. I would suggest that we start out by finding the folks who are highest at risk, and those are the folks that have major diseases. I'm talking about the people with cancer, the people with pre-existing conditions that are significant, that prevent them from getting insurance or uninsurable. We find that people who have diabetes, really a long laundry list of life-threatening type diseases. And we bring those people under the auspices of Medicare, and we expand, Medicaid, and we expand Medicaid basically to deal with those folks. I would support making that transition, and then those folks who are being forced to buy insurance, who have had their benefits cut or have had their premiums raised, I would get rid of the mandate that they have now and get rid of the fines and so forth. So basically repealing Obamacare eventually altogether and transitioning more to a first-party payer through expansion of Medicaid would be my approach to the situation. I think we would have a much better system overall. I keep saying Medicare, maybe I said Medicaid. I get the two confused sometimes, but Medicaid is what I'm talking about here. And for those folks who are on Medicare, of course, they're already covered. Those folks are over 65. We know that the subsidies under Obamacare, as projected out over the next 10 years, are not going to be sustainable with the federal spending that we're doing and being able to cut the spending and basically paying off the debt. It just cannot be done. We're looking at basically annual expenditures just to cover subsidies of somewhere in the area of 98 to 100 billion dollars per year over the next 10 years. So that's got to be dealt with, and it needs to be dealt with immediately. In the area of education, I'm really opposed to what Ms. Clinton has proposed with paying off student loans for people, using taxpayer dollars to pay off student loans. I think when our kids in college making educational choices, they should be making educational choices toward a particular vocation that they have in mind. And if they pick a vocation that doesn't pay very well, that it's going to take a long time to pay back that student loan, they know that going into it. And so they know that it's going to take longer to pay back that student loan, and they need to assume that risk. If, in fact, they can't pay that loan over time, then that's their personal problem. They need to take responsibility for that. It should not be a taxpayer burden or problem. And as far as extending taxpayer dollars to pay for college and universities and graduate schools, as Ms. Clinton and some others have proposed, I would oppose that as well. We see people who sometimes just want to be a professional student, and they just want to go into school and they want to stay in school. It takes 5, 6, 7, 8, 9, 10 years to graduate from school. And where will the abuse lie with that? We're going to have people who just want to stay a student so they can keep getting federal funds to keep going to school. We've got to basically put a cap on our spending, and creating such new programs is just not something that's going to work long term for us. One of the other things as far as education that we've got to deal with is we need to get the federal government out of local education decisions. Education really should be a state issue. The states, it's not like a baseball game and you've got some umpire that's standing out in the outfield and he's trying to call balls and strikes. We need the umpire closest to the play who's going to make these calls on education. And that's the state level officials and the local school boards that deal with education in their own local communities. They know what their needs are. They know what they have to have as far as dollars, what types of schools they want to have, how they want to set up those schools, whether they want them to be charter schools or whether it's public, whether they've got private schools, how they want to handle school vouchers. That's been a subject of a big topic of late. Just how they want to do that on a local level should be a local issue. Now I realize there's a lot of federal dollars right now going into education. And I would say we cut those federal dollars from education. It would take some transition to do that. We don't want to leave children who are left without nutrition because they don't get a school lunch or school breakfast or whatever that's coming from federal dollars. But I think we can eventually transition all of that money to the state level, and the states can deal with their own people within their own states on education and set up the type of educational programs basically to match what their economies have in each state. Each state is different in America, and basically each has a different type of market for what they're educating their children for. And so what we've tried to do is through No Child Left Behind and some of the other educational policies that we've established, we've tried to make a one-size-fits-all educational policy for America. And overall, it really hasn't worked. It's put a lot of burden on teachers to have to make sure students pass certain grade level tests at the end of school and all that. And basically, sometimes teachers' pays have been tied to whether or not their students are passing tests. We would eliminate all those types of federal mandates. We would go back to a system of just having state and locally run school boards.